Dr. Richard Besser. This morning, he has a new op-ed in USA Today titled COVID-19 Tsunami of Suffering. The pandemic isn't pausing. U.S. shouldn't either. Dr. Besser, it's great as always to have you with us. Boy, how frustrating it must be for you to watch and see doctors still having to tell people to wear masks, still having to tell people to distance. And I'm struck by how this is playing out exactly the way you and other public health experts told us it would back in February and March, that we'd go through a very difficult time. It might subside a bit in the summer and then come back with a vengeance in the fall and the winter. And here we are. So what can we be doing right now? What should be happening this morning?
You know, Willie, that's the big question. How do you get people who are, understandably really tired? They're tired of being afraid. They're tired of having to change their lives. How do you get them to do those things that we know work? They worked in the spring when the numbers went down in the states where they were high. Wearing masks, social distancing, washing hands, closing indoor gatherings, shutting down movie theaters and bars, and going back to pickup instead of indoor dining. Those things work, but the appetite for doing them is at a low. And when you hear such exciting vaccine news, instead of saying, okay, we're going to double down and do everything possible to get through this winter in a safe way, people are saying, thank God we don't have to do that stuff anymore. The vaccines are here. And that's not the case. They're not going to help us this winter.
So Dr. Osterholm was on a couple of minutes ago and said bluntly, please don't swap air. And by that, he meant don't be in confined spaces with groups outside your household. Don't do a big Thanksgiving. Even when you have a mask on, sometimes if you've got a bunch of people in an indoor space, you're swapping air with them, and that can be very dangerous. He also said, Dr. Besser, which kind of stopped us in our tracks, he said this moment right now, as we sit here, is the most serious in American public health since 1918. So what is your assessment of where we are as now we head into Thanksgiving and the holidays?
Yeah, I think Mike is right. He's got a blunt, clear way of helping people visualize this. This is the time of year when viruses thrive. They love the cold. They love low humidity. They love it when we're in close indoors, when our behaviors change. We can't spend time distant in a way that we enjoy. Activities move indoors, and viruses just take off. And if we don't follow the science, if we don't do these things, it is going to be a dire winter. The other part of this, Willie, and I know you all talked about this earlier, is that following the science means following the science. And in many places, schools have been able to open safely. I'm a pediatrician and a parent, and for many children, being in school where they can be observed watching masks, observed social distancing, is the safest place for them. And we haven't seen much in the way of transmission between students and to teachers and staff. We need to make sure teachers and staff are safe. But if the science is saying it's the safest place for everyone to be, let children be together. Let them learn. It's great for their physical and mental health. It's great for their education. And in many places, it's the safe place for them to be as well.
Thanks for checking out MSNBC on YouTube. And make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.